level 1, we covered the fundamentals of muscle oxygenation and what NIRS actually measures. Now it's time to go deeper, because collecting data is easy, but collecting good data is where the real performance insights begin. This first part of the level 2 series, we'll talk about signal quality, noise, and artifacts. Why signal quality matters. One of the biggest mistakes in muscle oxygenation training is assuming that every graph is automatically meaningful. NIRS is incredibly sensitive. That's what makes it such a powerful tool. But small movement changes, pressure differences, sweat, skin contact, ambient light, or movement can all influence signal quality. What good data looks like. A high-quality signal usually has three characteristics. There's a stable baseline, smooth physiological responses, and a logical transition during exercise. When intensity increases, oxygenation should react in a predictable way. If the graph behaves randomly, spikes excessively, or disconnects from the exercise demand, you may be looking at artifacts instead of physiology. Common sources of noise. Here's 7 common sources of noise. Sensor movement, poor skin contact, compression changes, sweat accumulation, high impact movement, external light leakage, or muscle contractions under tension. Not every fluctuation is equally meaningful physiology. Especially in dynamic sports like team sports, high rocks, or skiing, you could be looking at movement artifacts instead of real physiology. Some practical tips to improve your signal quality. Make sure that the sensor is secured firmly. Minimize sensor movement. Use consistent placement. Avoid excessive pressure. And check your warm-up stability before testing, so during the warm-up you can quickly see what the data looks like. Good data collection starts before your workout starts. In this second part of the level 2 series, we're looking at muscle oxygenation versus blood flow. So what exactly is the difference between muscle oxygenation and blood flow? One of the most common misconceptions in NIRS is confusing muscle oxygen and blood flow. They are related, but they're not exactly the same thing. What muscle oxygenation represents? Muscle oxygenation reflects the balance between oxygen delivery and oxygen utilization, the supply and the demand. There's essentially a dynamic balance between these two. Why more blood flow does not always mean a higher oxygenation. During intense exercise, blood flow may increase dramatically while the muscle oxygenation still drops. Why? How is this possible? Because oxygen consumption can actually rise faster than the delivery. Some practical examples. For example, the warm-up or sprinting. In sprinting, blood flow may temporarily reduce due to mechanical compression, while the oxygen extraction still rises rapidly. This causes your blood flow to stop and your oxygen to desaturate. During easy endurance, we see that blood flow is sufficient, whereas the oxygen demand is moderate. Therefore, oxygenation often remains relatively stable. In local muscular fatigue, for example, strength training or sled work, you may see severe local deoxygenation despite a strong cardiovascular output. So you're working in an occluded state. The key takeaway: when interpreting your train red data, you should ask, can the oxygen delivery keep up with the oxygen muscular demand? Total hemoglobin is not something you assess live or during your session, but afterward. In this third part, we are looking at baselines, thresholds, and exercise testing. In this first scene, we're talking about the baseline levels. Baselines are one of the most misunderstood concepts in muscle oxygenation. A baseline is not a universal number, it's actually a contextual reference point. Why do these baselines differ? Two athletes can produce identical performances with very different testing oxygenation values, so avoid comparing raw baseline numbers between athletes. There are many different reasons why these baseline levels differ. Could be the fitness level, the muscle size, some adipose tissue, or sensor placement, muscle type, or vascularization of the athlete. A dynamic interpretation. What matters most is the response pattern, the change from baseline to recovery, repeatability, the desaturation. It's the trend that contains the most valuable information. Threshold protection. As exercise intensity increases, muscles often reach specific transition points where oxygen behavior changes. These transitions may relate to your aerobic thresholds, your lactate accumulation, recruitment changes, or local muscular limitations. Exercise testing. With structured testing, our sensors can help you identify your local muscular limitations, asymmetries, fatigue resistance, recovery kinetics, and pacing strategies. But keep in mind, thresholds are not magic numbers. They are interpretation tools and should always be combined with the context, the exercise performance, your perceived exertion, and your coaching insights. In this fourth part, we're looking at common myths and misinterpretations. Myth 1. Lower oxygenation is always better. False. It is not the case. Extreme deoxygenation does not automatically mean better training. Sometimes it reflects poor perfusion, excessive intensity, premature fatigue, or inefficient pacing. Myth number 2. Higher oxygenation means that you have a better fitness. This is also false. A highly trained athlete may actually show lower oxygenation during maximal work because they extract oxygen in an extremely efficient way. Myth number 3. There's one perfect SmO2 number. There is no universal ideal percentage. The context matters, the sport matters, the intensity matters, the muscle group matters, the athlete matters, and the testing conditions matter. So there's a lot of different causes of this magic number to change. Myth number 4. NIRS replaces coaching. As much as I'd like to say yes, NIRS is a tool, not a replacement for critical thinking. The best results will happen when physiology, coaching, and athlete feedback work together. In this first video of the Level 2 series, we covered signal quality, artifacts, oxygenation versus blood flow, baselines, thresholds, and common interpretation mistakes. These concepts are essential if you want to move beyond simply collecting data and start making better training decisions with our sensors.